So in CLL to date, we really have not had curative therapies really outside of the allogeneic transplantation experience. But that does not mean that CLL is completely incurable, and I'm really optimistic now that we have so many different effective tools that if we find the right combinations, we may be able to cure a subset of patients with CLL. Now, there's a lot of patients with CLL where we don't necessarily need to cure them. So our older patients, especially those with low-risk genetics, we have some very effective therapies already that we can control the disease. We can extend their life with good quality of life, and I think that's a very reasonable goal for that population. On the other hand, we do still have young, fit patients with CLL, and particularly those with high genetic risk disease, and I'm not confident yet that with the tools that we have, we'd be able to extend their life to live whatever their normal lifespan should be. So when we talk about cure in CLL, that's really the group that I'm thinking about, the younger, fit patients with high-risk genetics. And I'm optimistic now that we have some of the more immune-based therapies coming into CLL, like CAR T cells and bispecific antibodies, that we might be able to find a subset of patients that we can cure using combinations of those different immune-based profiles. Because allogeneic transplant, again, was sort of the precedent for curing CLL. So if we have more effective immune-based therapies for CLL with less toxicity than allotransplant, I think that could potentially be a pathway toward cure.